right. We'll go ahead and get started. Thank you so much, everybody, for joining us here today. I know with the holidays, times can be a little bit stressful, so I hope today is a day where you can just have a moment to relax and just pay attention to all the wonderful things that our local community health departments are going to be sharing with us here today. So we are missing one who will be here very shortly, but could we please give our community health department folks a round of applause and a nice warm welcome. Thank you very much. Okay, so the style of today's meeting is going to be a little bit different than what everybody is used to. We are going to have our health departments introduce themselves and let us know where they're from, share a little bit about what they do, and then we have some questions that we have prepared in advance for everybody. And then if you all as participants, both at home, living, joining us via Zoom, or anybody here in person has any questions for the folks up here, you can go ahead and ask those after they're done responding to the questions that we ask them. And then after that, if there's any questions at the very end and we still have time, we'll be happy to do those. And then I also just want to say, I don't see anybody here. I don't see anybody here from the tech right this moment, but maybe we could give a round of applause for the tech for continuing to host us, and then also, and then also wanted to share that New North has been able to help us with lunch today, which is from Crazy Donkey. So I'm going to go ahead and turn it over to Sarah Schneider, who will be asking our questions of our panelists here today. So we're going to zoom in on our panelists so that you can see who is speaking. So the voice you'll hear off to the side for people at home is Sarah Schneider. So you're up. Thank you. Thank you. That's good.
Testing. A special welcome to everybody today. It is so great to see those of you who were able to come in person. The sun is out, but the temperature is chill, and the food is amazing. So for those of you online, hopefully you will be able to support our local entrepreneur another time. We're going to be worth it. Today I'm honored to be able to present our panelists today from the respective health departments. We're going to let each of our presenters introduce themselves, and I do know there's one microphone, so we'll start at this end, have you introduce yourself, the department you're from, and your title, how long you've been with the department.
Good afternoon, everybody. My name is Zachery. I am the Public Health Officer / Public Health Supervisor for Calumet County. I have been working with Calumet County specifically since September of 2022, and I'm actually been in the current health officer position since October of this year.
Hi, I'm Gieryn, Winnebago County Public Health, Health Officer, Health Director. I've been in Winnebago County as Director for about 20 years now, and in public health for about 30, worked for the city of Milwaukee prior to moving to the Fox Valley.
My name is Dr. Chuck Sepers. I am the health officer and director of the Appleton Health Department. Sorry, I can't speak at all today, so sorry about that. I've been in this role for about 2 years. I've been a health officer for about 5, and I've been in public health practice for about 15 years.
Hi everyone, I'm Kristine. I am the Public Health Director and Health Officer for the City of Menasha Health Department. I've worked for the City of Menasha for about 5.5 years and been the Health Officer for about 2.5.
Good afternoon, I'm Natalie Vandeveld, Health Officer with Outagamie County Public Health. I've been with Outagamie County Public Health, it'll be 24 years next year. Started out as a health inspector and then became manager for the environmental health unit and then transitioned to the health officer role right at the start of the pandemic, March of 2020.
Kristine, you can hang on to that. Natalie, I do know you, so we're going to start with you, and you get to answer the first question. And Kristine, please piggyback on to the first question, which is, what is the role of public health? please provide a high-level overview because there are so many people where you operate that don't know what your department does.
Sure, I'm actually gonna start this question. Public health's overall purpose is really to protect and improve the health of all people and our communities. We're concerned with protecting the health of entire populations. So that's in contrast with healthcare, which is really focused on treating sick individuals. We aim to prevent illness and injury from happening in the first place. In Wisconsin, we have local health departments at the city level, county level, city-county level, county-county level, and we also have tribal health departments. And our statutes define local health departments and our local boards of health, and that includes what our powers and duties are, what services we need to offer, and other regulations. There is what we call DHS Chapter 140. It's an administrative rule that outlines our required and additional activities that we need to have. There are 3 different levels of health departments in the state, level 1, 2, and 3. There is a minimum set of requirements that all need to provide, which would be that level 1, and then there's some additional ones as you go up to level 2 and level 3. So Natalie will talk about our foundational public health services, which really encompasses those core set of services that health departments need to.
Okay. Yeah. Is there any time I can plug your power?
If you're
He said 12:30, but I don't know if that works out. Or I can plug you into an extension cord.
Kyle looks like he's trying to use somebody too. It happens. No worries.
Great. I'm gonna just carry on with that question. As Kristine mentioned, there's a term that we've been using, a framework called Foundational Public Health Services in the back of the handout that describes what Kristine mentioned with our DHS Chapter 140, but also the framework that was newly updated last year. And it really allows us to, as we are evaluating our programs following the long pause with the pandemic, we are using as a framework of ensuring that the level of services, the foundational areas, which is a baseline of services that should be existing across Wisconsin. No matter what community you live in, you should be able to rely on your health department to provide those foundational areas. And the framework also talks about foundational capabilities. Those are cross-cutting skill sets that support those foundational areas. And really it ensures that health departments have a true north as they evaluate the programs and provide that unique governmental public health service to anyone in our community. And again, each health department is doing this assessment and evaluation using this framework. Feel free to, again, reach out to the back to find the handout and look more into the foundational public health services. The state and every health department is evaluating our work based on the foundational public health services.
Thank you so much, ladies. I'm going to turn to the next question, but actually before I do, I want to encourage anybody in the audience that has a question, please raise your hand and I call on you. And Kyle is administering our chat box. So for those of you online, if you have a question, please send it over. We'll make this interactive so that you can get the best and most valuable time out of your lunch hour. So the next question I'm going to turn over to Zach. So we'll pass the mic on down. Zach, the question for you that we're all interested in hearing is, as it pertains to COVID-19 and influenza vaccines for all ages, what programs and resources are available to access these vaccines?
That's a really good question. As we found with the COVID-19 vaccine response that was directed by the federal government, vaccine was widely available, easily accessible, but with the move to commercialization, that process has become somewhat fragmented. So there are a handful of different programs that are available that individuals can use. The first, probably more common program is the Vaccines for Children program. It's been around for quite a long time, and it provides vaccines at low to no cost for individuals that are under the age of 19, they have Medicaid, or are uninsured or underinsured, or are Alaskan Native or Native Americans. The COVID-19 vaccines are available through that program, as are influenza vaccinations. However, you gotta find a Vaccines for Children provider. Many local public health agencies do participate in the Vaccines for Children program, as do a lot of primary care providers and most pediatricians. So for your children under the age of 19, that's probably one of the best avenues to utilize. For adults or individuals over the age of 19, there's two different programs that were implemented to provide vaccinations in general to that population. The Vaccines for Adults, or VFA program, provides a wide range of vaccinations, not including COVID-19. So that's where individuals would go to get their influenza vaccinations. Now, there was an addition to the VFA program this past year, which was called the Bridge Access Program. The Bridge Access Program is what provides COVID-19 vaccines to that population. Now, the net of providers that use the Bridge Access Program is a little bit more limited. Most of your local public health agencies and federally qualified health centers participate in the BAP or the Bridge Access Program, as do a couple retail pharmacies. That would include CVS and Walgreens, plus there's like an independent pharmaceutical corporation that has some smaller pharmacies that I've never heard of the name of before, so I'm just gonna kind of not go into that realm, but CVS and Walgreens are gonna be your main places to go. I caution individuals, though, if you are interested in getting a vaccine through really any retail pharmacy, call them first, because some of them advertise carrying the vaccine, but not all of them always have it in stock. But those are your two retail pharmacies that primarily serve the Bridge Access Program. Retail pharmacies in general, Sam's Club, Walmart, Walgreens, CVS, they all, to varying degrees, support COVID-19 vaccinations as well as flu vaccinations. But again, it depends on what vaccines they currently have in stock. So if individuals are interested in getting their COVID vaccine through a retail pharmacy, it's best to call them. I can use Walgreens in Chilton, for example, actually vaccinates down to the age of 3, but they don't always have vaccinations for the younger children in stock. And so I hate for people to make that trip in and not to be able to be served. An easy way to go about identifying where you can find COVID vaccinations are using vaccines.gov. You can plug in, or excuse me, vaccine.org. You plug in your zip code and it'll pop up a list of providers that are offering vaccinations and provide you with their list of vaccinations that they're carrying, as well as phone numbers to reach out to them. One last piece that I wanted to add in, not specifically related to vaccinations, but COVID-19 in general, is there is still the telehealth program that's available for individuals that feel like they may be becoming sick or they have tested positive on an at-home test and they're looking for support. The COVID-19 telehealth program is completely free. You can access it on the Wisconsin DHS website, and those providers can actually prescribe antivirals as well to help lessen the severity of your illness. I think that pretty much sums up the COVID access.
Zach, that's incredible, and I'm picturing as you're talking, the blue Band-Aids, like, what's the campaign? I got 2. So, that's a great clarity that they're not all equipped to serve. Gina's got a question right in the front row.
Thank you, Zach, appreciate that. So you had mentioned the vaccine website, where you can find COVID-19 vaccines. I did also notice too that you have the option to choose to only show me pharmacies that do the Bridge Access Program, which is great. So that's an additional resource. How can people determine where, and I'm sorry if you had mentioned it, but is there a resource or something like that that exists for the children's program that you had mentioned?
Yeah, so I know for sure that the CDC's website, the Vaccines for Children program, as well as Wisconsin DHS, provide a VFC provider tool that you can click on, plug in your zip code, and it will pop up a list of VFC providers in your area. I've only used it a couple of times, but the few times I did use it, it seemed like it was a pretty easy to access tool.
Great.
Hello, everybody. This is Dr. Pamper. I have a quick question for you, Zach. As we move from COVID, so you know, through COVID, MCI did a lot of community organizing in terms of community health events. We're getting calls at New Monk professionals from our community members who are used to coming to our health events and things like that, and being able to have access to COVID-19 boosters as well as vaccinations. You know, we're starting with the flu vaccination, all of that. Is there any sort of ability to organize something like that through a pharmacy, through a health system, where we can get that piece again within our community? Or is this a individual basis only now? We're not doing any more community organizing. We're not allowing our people to do that, and then that's one question, how do we do that? How do we continue to access that piece? The second question is it all paid now? So there's no free, so if if you're uninsured, of course, there's things to cover that, but it's really not walking in without any sort of medical insurance or, evidence of that. Thank you.
So I'll tackle the second question first, since that one's a little bit easier. Truly, all the vaccinations at this point still should be free of cost, because you've got the Vaccines for Children program that's covering vaccinations for that uninsured, underinsured Medicaid population. You've got the VFA program that's covering vaccinations for adults. And the COVID-19 vaccine right now is supposed to be covered by private insurance companies. There was an issue when the commercialization first occurred where people were being charged for their vaccinations, even though it was being promoted as being free. The issue behind that was the insurance companies didn't have the new CPT codes needed for billing uploaded into all of their systems. And from what I've heard, the bugs have been worked out on that. So truly at this time, there still should be no out-of-pocket costs for individuals looking for vaccines. The first question now about kind of access, it's more up to each individual county now or local health department in their jurisdiction on how that's being facilitated. For the most part, it is much more of an independent effort. So for example, earlier this year, we were working with Ascension to try and provide community vaccinations to Calumet County. It was a lot of work to try and collaborate. The healthcare systems are over inundated yet with respiratory viral illnesses. They've got a lot going on, and being able to carve out a space for us to be able to go in was one challenge that we had. Identifying a date time in a room within the hospital setting that we could utilize that wasn't being used was challenging. And for us in Calumet County, uptake has been low recently. I mean, it has been for the last year. And so then you had to prioritize how effective is this effort that we're putting in? Are we reaching the population that we're working towards? It wasn't very successful for us, but what we found is by providing homebound vaccinations, taking vaccines to those who can't leave their homes to be able to get it, partnering with organizations like the Multicultural Coalition allows us to expand the access. So hopefully it does give more opportunities to individuals to go and get vaccinated versus if we weren't doing that at all. But it definitely is a different landscape now than it was when the federal government was leading this massive vaccination effort. If any of my colleagues up here would like to speak to their counties a little bit more, if there's anything interesting, feel free to.
Yeah, and just to circle back to that first question, another perspective too is like flu vaccine, the COVID-19 is a commercial product now. So for those of us without medical billing, certainly Appleton, I know others are not currently running a medical billing program. We don't have the capacity to even provide that vaccine for a third-party payer to be able to cover. So in that case, there's no reimbursement. So somebody has to buy the vaccine, right? And so that's the biggest barrier for those of us that are not retail pharmacy partners. But that retail pharmacy partner space is really the final frontier in terms of the that community organizing around possible health events, the way I see it, because they have vaccine. They're more likely to get vaccine. They have medical billing, capacity, means they can take insurance and that kind of thing. Whereas I think all of us are VFC providers. I think we're all running the Bridge Access program. So if you don't have insurance, your local health department is a good option. But again, with uptake being very low, I think City of Appleton, we've been running the Bridge Access program for about 3 months. I think we've given 1 vaccine, right?
And if there's time, I'll just tack onto that.
Please do, Doug.
All right, yeah. So when we think about vaccines and public health, we typically think of public health being a provider of last resort, unless it's a response. So, COVID, monkeypox, 2009 H1N1, we were, kind of at the forefront of trying to make sure that there was access to vaccine available, certainly for COVID. We partnered with healthcare and pharmacies. Ultimately, healthcare and pharmacies gave way more vaccine than public health did, even though we ran, large clinics over a long time period. Our goal with immunizations, if somebody's coming in for immunization, is to get them hooked up with a healthcare provider. We don't want them to come to public health just for a vaccine. We want them to see a healthcare provider so that they have, well-rounded care. They have a medical home. We want to get them hooked up with an insurance provider. So if they don't have insurance, we're asking them, how can we help you do that? Can we get you hooked up with partnership? Can we get you hooked up with a free clinic? We want them to have a medical home, but we're still going to be there for those that need it. And so at this point in time, COVID has gone the way of all the other commercial vaccines. Public health plays a minor role, provider of last resort bridge access program. You're probably gonna have more access, going to a pharmacy unless you're in a rural area.
That's great clarification, Doug. Thank you for adding that. Pass the mic over. We're playing hot mic here, and I'm gonna ask Chuck you to take this next question. I think it builds on a lot of what we've already shared, but what goals or initiatives do you have coming up in the next 5 years, and how will they benefit the community at large, or how can the community support your goals?
Sure, and then I'll touch on some of what we talked about previously in terms of the state statutes and kind of how this all comes together. So the chapter DHS 140 state statute that we had talked about sort of sets the framework for this. We locally could say, oh, I would like to work on this, or I'd like to work on that. But the statute really requires how those priorities are set, and that's through our community health assessment. We're all at different stages in that process. City of Appleton, we are currently going through our CHA, or our community health assessment right now. I'm looking at our team in the back there, just leading that charge last week. So in terms of where we are in that prescriptive process, we are just getting started. We have not conducted a community health assessment since 2019, but I'll just talk about the process overall, and I'll talk about something really exciting that I think that we can all kind of find hope with. But so you've got 3 different levels, right? So you have Healthy People 2030, which is the federal priority for how we think about how we think about public health more generally. And I think there's I just walked away from a session here just a couple weeks ago, something like 243 different indicators in the Healthy People 2030 plan, with some general focus areas really related to those upstream things. So as we think about, as Doug was talking about, the provider of last resort with vaccines, this comes to a broader framework of what we call Public Health 3.0, which is really related to where public health is going in the future. This was a position paper that came out in 2017. The CDC envisioned what the role of public health was going to look like as healthcare. Is that more clinical service partner. Our colleagues had talked about that difference between what public health is, what healthcare is, and so moving out of that clinical space, what is that role? So Healthy People 2030 sort of sets that up with the understanding that as we focus on social determinants of health, so much of people's health depends on what their zip code is, where they live, what their social and policy environments are, more so than individual behavior. We all make choices. We all make health choices based on what our reinforcement histories are, if we're thinking about it in that framework, or what we have access to, whether it be in vaccines or other things. And then leading into that is the SHA, or the State Health Assessment, and then the State Health Improvement Plan. Very, very similar to what happens in a local context. The state has to conduct a a SHA, or a state health improvement, or a state health assessment every 10 years, and then it's usually between every 3 and 5 years on that state framework. Very similar at the local level. So our statute requires that we do this every 5 years, and that is what we focus our efforts on. We're locked in to that process because that's what the community has identified. These are the issues that we want to prioritize. So those are that sets the stage for what are the grants that we're looking at. So and I've got some of our local ones here. So as we're going through, Outagamie County is mental health, access to care, housing, and homelessness. We expect our data, as most Appleton residents live in Outagamie County, to be very similar. So those are the things that we expect to work on. As we prepare for that, we have created a new community health section within our Appleton Health Department, which Brianna there in the back is leading. Right now, that section contains 2 staff members who happen to be sitting next to each other. Liz is our coordinated entry specialist, and this is getting to that piece of how do we move upstream in our interventions, moving the coordinated entry specialist position from our community and economic development department into our community health section is one that focuses more squarely on those upstream social determinants. And as we think about how housing and homelessness interface with mental health, social connectedness, all these other things, this is a position to where we begin to prepare for that strategic effort. We're looking to grow this team. In fact, this week we're going through our legislative process at the city to add some more staff to that section in that role, or to expand those roles. But those are some of the things that we have going on here in the next 5 years that we'll be building on.
Outstanding, thank you, Chuck. Very exciting, and I know for the counties, the CHIP program is well on its way. So thank you for your hard work in that. Any questions online, Kyle? Are we still rolling? Okay, last questions for Doug.
If I could just chime in, I had 2 minutes. I thought
Oh,
I saw
well,
I'm sorry, that was like
just a window into the future. So with the 5 health departments and our 4 local hospitals, and then with Partnership Community Health Center, that's 10 entities that all have to do this work. And what that looks like on the ground is all of our grassroots organizations, all of our 501c3s, all of our stakeholders get tapped on the shoulder to be asked questions or to participate in focus groups and all these things. That is so wasteful of the resources that we have. So one of the things that we've been working on this year, and this team is extremely proud of, is that we have been working to develop a regional tri-county process that will bring all of this under a single community health assessment and a single community health improvement planning process. So.
My favorite thing about this community is our collaboration, and so thank you all for that work. We have a question in the back coming live from Miss Maria, and I will have that microphone to you right now.
Thank you. Where can you find the CHNA documents published?
Yeah, so they are on the handout that Natalie has prepared and is in the back.
Excellent question. So before I open up the full agenda for questions, I have one that's near and dear to my heart. And Chuck, since you're holding the mic, I'm going to ask you, because you are the department, I'm familiar that this is, and if any of you others have this, I'd love to hear about it. But I love that the city of Appleton has a health and all policies program. Could you expand on what that is?
Yeah, so health and all policies are simply the idea that health must be considered in all policy making that were to happen. With that, the city of Appleton has a health and all policies ordinance, and that states a particular process in which the city considers health in all of its policy making, whether it's at the legislative level or as we develop policies and procedures at the section level.
Thank you. Anybody else can speak to health and all policies?
And just from a practical standpoint, I guess, from Outagamie County, Mary Dorn, who is our Health and Human Services Deputy Director, she was the health officer of Outagamie County, starting in 2015 and became Deputy Director. So in our large department as Health and Human Services, over about 430 people, 6 divisions, having Mary be part of our leadership, knowing public health intimately, does help promote public health across all of our divisions and across our departments. So as Chuck mentions, that's an important work of having policies, and we as a larger department, infusing that public health into all policies day to day has been helping us, knowing that Mary, from our leadership perspective, intimately knows public health and can pull me in. And COVID obviously was a good example of that too. We were being pulled into many different areas, and we are now a natural partner to the table, which was not seen before. It was seen as more an emergency response as preparedness, but now we're seeing that public health, health and human services is really public health is a unique eye in that perspective.
Thank you both. I'm going to wrap up our panel with Doug with a question that is so near and dear to my heart, Doug. The Surgeon General did speak to the importance of social connectedness and the consequences of loneliness and isolation. Are there any programs or services in place to support people feeling more socially, helping people be more socially connected?
So yes, there are, but it's complicated. It varies tremendously from community to community. And so what I'll do is I'll just gonna take a little walk through this topic, much like we might engage, a citizen group, and to get feedback on, we won't have a lot of time for that, but what I'll do is just kind of walk through what are the highlights in that report, and then a couple of examples of how we've started to engage, because loneliness and isolation, well, it's been declared an epidemic, and it's a public health, emergency or public health epidemic. It's way beyond public health to address alone. And so a big part of our role is how do we help, raise the issue? How do we provide data, information, best practices, engagement, and resources to really help the community to respond as a whole, from the individual level, right, to the governmental level, to school systems, to businesses and others. So, we think, and this is a complex issue. It's also an issue that, if, there's certainly a portion of the population that views an issue like isolation and loneliness as an individual choice, as opposed to a construct of how our society functions. And so what's really, what we see is like with other chronic diseases, and if we think of loneliness and isolation as a chronic disease, we know that there are a large number of inputs that have influence on that, and as you've heard, like where you live makes a difference. And really, from the report, we know that whole society approach, like we have with other chronic diseases, is necessary to make a meaningful gain. So nearly half of US adults report experiencing loneliness and isolation. We know that loneliness and isolation leads to negative health consequences. Those consequences include, increases in rates of chronic diseases and premature death. There's a lot more we can go into that, but we know that it has a significant impact, and we've linked that and through lots of evidence that's now available. And and we're kind of at a point of like, this moment where we're making a big deal out of this, but we've been heading in this direction for decades. And there's a lot of influences, for that, the use of technology, the advent of social media, rates of social participation in communities, people being involved in their community at levels that are declining over time, how much trust people have with each other. You know, we've become more polarized and political. There's less trust and less discussion. We have less close friendships. We have more single person households. And so there's all of these factors that contribute towards more isolation and loneliness. You know, and there are individuals that have risk factors that are more likely to set them up for, or, you know, predict that they may have an issue. And, you know, some of those risk factors that, you know, that we want to focus on so that we can equitably respond to those that really need the support the most, you know, include those with mental health issues, those with disabilities, people that are financially unstable. This list is going to sound familiar for a lot of issues that we're dealing with, right? Single parent households, living alone, which has gone up tremendously. Young adults, surprisingly, are impacted by loneliness as a single adult than persons over age 65. So that's kind of a surprise when you read the report. Ethnic and racial minority groups, LGBTQ individuals, rural residents, victims of domestic violence or just, you know, abuses in the home or child neglect, those adverse childhood experiences, discrimination, marginalization, and I'm sure there's more, but those probably resonate. And so what, you know, when we think about social isolation, loneliness, we think about what do people need to thrive in that space, right? They need meaning in their life, they need purpose in their life, and they need to have some motivation. And when those are missing, you know, you have consequences, you know, of, you know, depression and anxiety and, you know, loss of will, and those all lead to behaviors that, you know, are negative and decrease the quality of your life and the length of your life. And, you know, we often talk about life expectancy and life expectancy going down, but what's even more important is the years of quality life that you have, not just how long you live. And so being deliberate about measuring those years of quality life is really important too. So what we also know is that, you know, we see impacts at an individual level and we see impacts at a community level. Connected communities are safer, right? They're more engaged. There's more civic participation that occurs in highly connected communities, and that feeds, you know, it feeds on itself to help improve communities overall, and then the opportunities for individuals within that community to become engaged. So what are the things that we can do? The last question that you asked just led right into this: health and all policies, right? How do we build and be intentional about having connection as a part of that health and all policies question? When we look at policies, existing policies and new policies, how do they impact health? How does connection fit into that? Does that, you know, unintentionally disadvantage some groups such that it creates, you know, greater issues in those groups? So how do we try to identify those? How do we screen those tools and look at those policies ahead of time? Our built environment. I mean, when we're planning for our environments and how we construct them and how we zone them, are we doing that with intentionality of community in mind? Training healthcare providers to recognize. So one of the things that we have been working on healthcare with, and healthcare has been working on, is really trying to identify those basic needs, social determinants of health, and have a screening for those as a part of their visits. And some of you may experience some of those questions with your primary healthcare provider already. We've got a ways to go. I'm always happy to hear those questions when I go, and then follow, you know, have a conversation with my physician afterwards about, you know, how maybe we could do that a little bit better. And so there's really an opportunity for improvement there. Increasing surveillance, public health can certainly play a role in that. How do we promote best practices? Using technology better. How do we use technology to bring people together as opposed to isolating them even further? Certainly more research. And then for us, and our elected officials and people we look up to help them model better behaviors when it comes to being socially connected. So those are, that's a kind of a quick summary of what that report is. Public health's been dealing with this issue for a while. I look back and, our community health improvement plan from 2016, our number one priority was social and place connectedness. And so we've been, we've started that work, and I'm happy to share some of the results of that. I know we're pretty much out of time here, but so we have some examples of what we can do. The pandemic made things worse. Gains that we had prior to the pandemic were certainly negatively impacted. And so we've got even more work to do than we have before.
Thank you so much, Doug. Any questions in the room? Curious minds? How about online, Kyle? Do we have anybody chatting in? Okay.
So quiet.
So what I love to do is I would like to reach back to our panel. Let's start with Zach so we can end with Kristine, just as we started at that end of the table, and just have you share 60-second overview what you really want this audience and everybody listening to take away from today. So Zach, sorry to put you on the spot. That wasn't a prepared question, but I hope you'll help us bring this home.
I think from my perspective is, even though we're out of the public health emergency, there's still day-to-day steps that we can take to increase the health of our communities, whether that be going and getting vaccinated, getting your COVID vaccine, getting your influenza vaccine. There's a new RSV vaccine on the market that older adults or those with high-risk health conditions can look at getting, protect themselves and those that we love. There's resources available for individuals that may think that they're coming down with COVID or another illness, so taking advantage of the telehealth program that's available and the antivirals that they prescribe. The CDC announced back in November that they opened up ordering for free COVID-19 at-home tests again. You can get 4 tests, it's a box of 2. So you can get 2 boxes, take advantage of that while it's available, because we don't know how long that's gonna last. So really take advantage of the resources in your community, because there is still a lot of viral respiratory illnesses going around. This is that prime time of the year where everybody starts getting sick. So the best that we can do is to take care of ourselves and make sure that we take care of those around us as well, and tapping into those resources that are available in your community.
Thanks, Zach. For me, it's about knowing each other, right? We live in a great community, and the better we know each other and share information, the better that we can be. And so, what I hope to do is to, know this group and the people that are in this room better as time goes on, to have you feel like you can reach out to your public health agency and say, hey, this is an issue that we're dealing with or an issue that we're seeing, and give us feedback, or ask for, if we have any information that might be able to help you. And because we're gonna be asking you for sure, as a part of our community health improvement plans, letting you know what we think you can do to help on the priority issues for our community. So I just want to make sure that we are very open with each other, and and that we have those difficult conversations. If you think they're difficult, then they need to be had.
So for me, so you've got 5 health officers sitting here at the table. It's the idea that public health starts and ends with the 5 people sitting at this table is not truthful. The truth of that matter is everyone in this room is a public health agent for change, right? So we have, in the city of Appleton, we have something like 15 FTE, right? It's ludicrous to think that 15 FTE can create the sort of efforts needed to protect all 76,000 people living in the city of Appleton. With that in mind, to build on what Doug was saying, we all have to work together, and we all have to identify ways in which we can be strategic, because what we don't want to do is make sure that we're duplicating efforts, or if only I had known X, right? And that's, X is something that somebody else was doing in this room or some other room. So we need to always be looking forward to how to connect and how to be strategic about how we align our efforts. And we all want the same thing. And you know, oftentimes it's easier to you know, put our blinders on and go for that one grant for the one thing, or you know, to you know, identify if there's a barrier here to go in a separate direction. It's much more impactful for the people that we serve, that we all serve collectively, to find ways to align those, you know, strategic efforts, our staff, our dollars, all of these things together in a way that we can have the most impact on the communities that we serve.
I would build off points from Doug and Chuck as well. I think it's really important to keep in mind that we are 5 separate entities, but we're all so close together, and we're all a part of the Fox Valley together. So while we might have some individual services that are unique to our own departments, we do a lot of the same services as well. And, you know, we can be a connector too for our communities. So it's not wrong if you know, think your health department's the city of Menasha, but really it's actually in the city of Appleton because your address is kind of funny that way. It's okay to reach out to one of us or the other, and we can connect you. We're partners, we play this game together. And then I think too that the collective impact that we can all have as working as community partners, coming all together, sitting at one table together, strategizing, this idea of a community health strategist that we really want to move towards, where whether that's public health as a local governmental public health, bringing people to a table, or us coming to somebody else's table to sit and have those conversations.
For Outagamie County, when we did our community health assessment, end of 2021, belonging or isolation was our top 5. So very similar to what was mentioned. With our community health assessment, our priorities for Outagamie County, our top 3, as Chuck mentioned, is mental health, housing and homelessness, and access to care. And we're actively working with work groups and partners and stakeholders to make some strategies and objectives to make some impact in those very unconventional public health areas. But as we've been talking about, going more upstream is what's pivotal at this point. And those work groups and partners that we're asking to commit time to us is important. We want to be that authentic, reliable partner. And with my colleagues up front, we can say that we are. But we had a pretty significant halt in our partnership, which is due to COVID. And we're hoping that we can come back to the table and be that authentic go-to as a local health department in your community.
Thanks so much, Natalie. Can we give our panel a round of applause? Incredible information shared today, and a couple of takeaways I gleaned were you are all vested in the community at large, not just your respective departments or with a narrow-minded focus, so I appreciate that. I also value that you are proactively searching for ways to serve our communities better and get ahead of the needs as opposed to be reactive to them. And so I hope all of you took that away and more. One last call out for questions of any of our panelists. Anybody in the room, anybody on Zoom?
I have a question.
All right, Kyle has a question.
You know, this year, I think we've heard a lot more about RSV than we have in past years. And for some of us, that's kind of a new disease to be concerned about. Would any of you be able to kind of, you know, explain how concerned we should be about RSV relative to COVID-19 and influenza? Should we be putting the same effort into vaccinating our clients for RSV as we are and as we have for flu and COVID?
This is one up for grabs. Okay, Doug.
So, you know, a lot of hoopla about RSV, and it's because we have a vaccine now. And that's really why you're hearing about it. RSV is, can be devastating to infants. Women that are pregnant, should be vaccinated. Infants that get RSV can get treatment. And then it's certainly an issue for seniors. I think the big message is that, it's now pretty much preventable with a vaccine. And that's the information that we really want to get out, and if people be aware of, that they can have that conversation with their primary care provider, and decide whether it's right for them.
Did he nail it? Zach's got it, add-on, perfect.
Yeah, I think the other thing that we're seeing with RSV too, as well as a lot of other viral respiratory illnesses, is during COVID-19, most people were masking up and social distancing. And so you saw a steep decrease in the numbers of those cases because people were doing those preventative measures that they were supposed to. But with the relaxation of a lot of the guidelines and the public health emergency ending, people are getting back out in the community, they're gathering again, and that natural immunity, that level of natural immunity that we had built up prior to the pandemic and taking all those preventative measures, it kind of got wiped out. And so we're seeing a more severe response in response to RSV. But I don't necessarily think RSV is any worse now when you look at severity of the disease than it was prior to the pandemic. It's just the fact that our natural immunity has weakened because of doing all the right things that we were supposed to do. So you're hearing a lot about it in the news. Last year, we had a horrible RSV season. This year, things potentially could turn out the same way. We're seeing steep increases in numbers down south, and that's slowly moving north. So it's just a matter of time until it's here as well. It's not something that's going to go away anytime soon unless we do proper preventative measures, getting vaccinated, continuing to wear masks, stay home when you're sick, those things that we do during any normal cold and flu season. So I just encourage individuals that either serve those with chronic health conditions or young children, talk to them about the RSV vaccination, let them know that it's available. I can say that the treatment that's available for infants right now is on short supply. That was kind of a fumble on the rollout, as it was widely promoted, and the state and the CDC told everybody that they needed to stock up on it, but then there wasn't enough to go around. It's very similar to early COVID-19. So we expect to see that supply increase over the coming months, but it's definitely another tool in our arsenal to help prevent individuals from getting sick.
Thank you both, and thank you all. Before I go into closing announcements and get us off and back to work on a timely basis, I am going to pass the mic to Kyle on behalf of MCC. He has an announcement for us all.
Yeah, so hello everybody, I'm Kyle Armstrong. I am the new Multicultural Communications Specialist for the Multicultural Coalition, Inc. I'm the newest member of the staff. Thank you. And in that role, I will be taking over for Gina Roberts, who has done an amazing job the last year and a half, 2 years of running these MCC meetings. And so going forward, if you have questions about the MCC, about these monthly gatherings, if you have suggestions for speakers, topics, or anything else, you can direct them towards me. If Gina gets them, that's totally fine. She'll forward them on to me, but I will be your new MCC guru going forward. So looking forward to what we can share.
That is exciting, Kyle, and thank you. And Gina did have to step out early today, so if you have an opportunity to shoot her an email or pass her a hug or a high five, she's done an incredible job of getting the meetings where they are today, and obviously today facilitating or coordinating our large panel. To wrap us up, I do want to inform everybody, it has come out on a couple of announcements. I'm going to try to get on screen in case the Zoom people want to actually see a human talking.
I zoomed out.
You zoomed out, okay, good. We have switched our MCC meetings for the months of 2024 to the 4th Thursday of the month. We've done that for scheduling and availability and numerous reasons, so we appreciate your flexibility. And with that, we do have our first presenter of 2024 lined up, and it is a very timely topic. I don't believe any one of you are going to want to miss it. People of Progression are going to be speaking about this very recent Outagamie County data that they've received. Many of you may have been at the Catalyst event. Had you not, this is a strongly encouraged event, and it will be virtual next time. So you can sit in the comfy of your pajamas or slippers or warm jackets, whatever leads you for that meeting. And with that, I will let you all go. Panel, you to get to eat. Please grab food, and we appreciate your time and for being here today. Thank you very much.